Hello, my name is Carl Cooper, and I'm the project manager for the National Disability Navigator Resource Collaborative at the American Association on Health and Disability, and this is our presentation, Health Insurance Jeopardy, Round 2, Double Jeopardy, Part 6, Accessibility. For those of you unfamiliar with the National Disability Navigator Resource Collaborative, or NDNRC, it is the mission of the NDNRC to provide cross-disability information and support to navigators and other enrollment specialists, thereby ensuring people with disabilities receive accurate information when selecting and enrolling in insurance through the Affordable Care Act marketplaces. I always say that when a consumer is looking at plans on the ACA marketplace, it is like playing a game of Health Insurance Jeopardy. I say that because those of you familiar with the game show know that in Jeopardy, it's not about the answer, it's about asking the right question. And consumers need to make sure they are asking the right questions about the plans being offered in order to make an informed choice. So let's play our game. For our Double Jeopardy categories, we are looking at some of the disabilities covered in our population-specific fact sheets. And today we're going to be looking at accessibility issues that come up when you're helping the various populations of people that we've talked about. For 400, this is one thing you need to think about when assisting a consumer with paralysis. The question, what is building accessibility? And building accessibility goes beyond just making sure that there's curb cuts and there's elevators to get to higher floors. It also has to do with how the building is set up and how your office is set up to make sure that someone in a wheelchair can get around and can get to a meeting place and to a table, and that it's not set up in a way where there's obstructions. For 800, this is one thing you need to think about when assisting a consumer with multiple sclerosis who has low vision. And low vision is a common issue that people with multiple sclerosis end up developing. The question, what is having materials available in alternative formats, i.e. large print? Many times when people think of materials in alternative formats, they think of Braille, but also for people with low vision, just having it in a larger print makes it much more readable for them. For 1200, this is one thing you need to think about when assisting a consumer with intellectual disabilities. The question, what is asking questions that verify the person understands the information? Don't ask questions in a way that say, do you understand? Because they may feel compelled to just answer yes if they feel like that's the answer you're looking for. Rather ask questions that are a little more interactive and ask them to repeat what you've said or what their understanding is of what you said to them so that they will be able to indicate whether they have truly understood the information as you've explained it to them. For 1600, this is one thing you need to think about when assisting a consumer with mental illness. The question, what is educating yourself about mental health conditions? There's so many stigmas associated with mental illness that many times people really, I think, end up making assumptions about people with mental illness, and this can ultimately affect sometimes the way services are provided to individuals. If you educate yourself and understand exactly what the population's needs are, and specifically what the consumer you're dealing with, what their individual needs are, that will go a long way to helping you being able to help the individual. For 2000, this is one thing you need to think about when assisting a consumer who is deaf or hard of hearing. The question, what is that individual's preferred method of communication? A common question we get a lot is regarding how to interact with people who are deaf or hard of hearing, whether they should be writing notes, whether they should get a sign language interpreter, whether they should just allow the person to read lips. The bottom line is you should ask that individual what their preferred method of communication is and operate in that way. And then, of course, since we're done Double Jeopardy, let's take a look at a final Jeopardy category of disability etiquette. And this is one word that sums up the best quality you can have when dealing with anyone with a disability. And when we're looking at all the accessibility issues that we just dealt with, this is really important to make sure that you're really trying to figure out the best way to interact with the various populations. The answer, or the question, what is respect? If you have respect for the individuals and treat them as you would want to be treated, then it will go a long way to gaining some confidence and some comfortability with the individual, and that individual feeling comfortable with you and feeling like that they can truly use you as a resource. If you haven't already seen it, be sure to check out round 1 of Health Insurance Jeopardy presentation, where we address topics such as prescription drugs, medical devices, rehabilitation and habilitation therapies, Medicaid eligibility, the summary of benefits and coverage, and mental health. If you're interested in finding out more about the NDNRC, you can check out our website at www.nationaldisabilitynavigator.org. You can also find my contact information on this slide. Feel free to reach out to us if you have any questions as you're assisting an individual with a disability enroll in health insurance. Also, please subscribe to our channel to get more helpful videos like this one. And if you're interested in learning about other disabilities listed, be sure to check out the links in the description below to access those videos. Thank you.